I'd now like to introduce, welcome back actually, Dr. Roger Harris, who will be speaking to us about ANZ Fragility Fracture Registry and interoperability with the ANZ Hip Fracture Registry.
Oh, here we go. Right. ACC, just so you know, ACC is the government agency that's responsible for prevention, treatment and rehabilitation of all injury in New Zealand. So in about 2016, they put $34 million towards developing fracture liaison services in New Zealand, and that was over 3 years given to health to get going. Now, the results were pretty variable because basically a message went out saying you need an FLS, and that was about it. There was no measurement, there were no standards, there were no direction on what an FLS should look like, and so pretty much everybody did their own thing. From about 2020, I mean, it's probably longer, if you know Paul Mitchell and Chris Gill from Osteoporosis New Zealand, they've been working with people in ACC for a number of years to try and develop a partnership program to get best practice fragility care going. But that was a formal thing that was announced in 2020, and finally, after a delay of a year, because the funding finished in 2019, they announced they were going to fund a national program for 3 years. So that includes FLS, community strength and balance programs, which are already in place, and also a registry. So that sentence at the top there, it's a very long sentence that's broken into 3 bits, but essentially it says we'll do everything we can to make this work. So the start of 2021, they carried out a survey just to find out what was going on around the country. And as mentioned above, it's pretty variable. So then there were workshops, sort of region by region, to engage local teams and try and develop a broad-based report. And also earlier in the year, they started developing the clinical standards for fracture liaison in New Zealand and consulting on them. So the next step is ACC, instead of just giving money to health, they're now doing a direct contract with each site. So that means we've got evidence-based staffing plans. So if you've got so many population, you get this many FTEs for FLS, so many FTE for clinical lead, and admin support, and those 3 things are compulsory. So the next thing is, if you sign this contract, you will contribute to the registry, you will go for IF accreditation for the capture the fracture, and you will be reporting. So the next thing is also the provision of ongoing mentoring and peer support to keep this thing going. Because you imagine we're getting new services, people have never done FLS before, they need training, and so people have been employed to do that sort of work. They've developed toolbox with templates, etc. So you can read all that quicker than I can say it. The Fracture Liaison Network New Zealand was set up in 2016 or so to support the FLSs to try and help them figure out what they're supposed to be doing. But that is now continuing on a much more strategic and funded network to provide monthly education and to act as a forum. Finally, in the middle of June 2021, we got funding for the registry. It was actually signed so we could actually start work. But before I get into that, we've just got to go back to the clinical care standards, which were actually published in September. They were endorsed by 17 ANZ organisations. It's based on the 5IQ model. That's, you know, the identification, investigation, implementation, etc., etc. It's got 16 standards and 15 patient-level KPIs. So it's based on this paper that came out in early 2020, which is a consensus document on what standards there should be for FLS, and they're pretty much incorporated in the New Zealand standards. So then we get on to registry development. The FLS nurses that were working told us they don't want spreadsheets anymore. They've had enough. So this is a patient management system. So compared to the hip fracture registry where you've got volunteers essentially collecting data and putting in the registry, these are paid people who are doing their work, and what they need is something to do their work on. And so that's what we've tried to provide. So it's got follow-up calendars, it's got notes, it's got clear records of patient progress, and if somebody's away, somebody else can come along and look after that patient. The data dictionary took a lot of work in consultation with Australia. It's got 82 variables, and you think, oh my God, that's a lot. But because people are using it for their work, for example, if they don't give treatment, there's a question about why not. You see what I mean? So that's why you get so many more variables. And we've got the form, and also we've developed interoperability with the hip fracture registry, so that if you're, I think about 70% of people in New Zealand are collecting for both registries. So for 15 variables, which sounds a little pathetic, I was a bit disappointed. If they put it in one registry, it automatically goes into the other. Hopefully that'll save some work. So we got that done by the end of November. There's also a lot of work to get through ethics. We've got opt-out consent, patient information sheets. That was finally approved at the end of January. Stuart had the software ready in March because he can't do anything until we've got the data dictionary done. And we're then into site approvals. The first one was pretty much instantaneous, and so the first people putting data in were in early March. Those of you in the hip fracture registry will see how familiar this looks, but we've got a binational steering committee. There's a data governance committee that is only just going to start work. We hope to develop a research committee in the future. The New Zealand Implementation and Management Committee is a sort of all-encompassing group. So we've got ACC reps, we've got Ministry of Health, we've got Health Quality and Safety, we've got every other sort of organisation you think of in that group. But then there's a small executive committee that runs the show. But we get feedback and ask questions when we have quarterly meetings. And then there's an Australian Management Committee that's been set up. So how have we been getting on? The site contracts, I think they're pretty much done for 18 of 21 sites. It took us 6 months to get through the site approval process for ethics. But now we've got them all pretty much trained and actually contributing data. Now, Stuart was telling me this morning that we're getting 35 entries a day. There's 22,000 fragility fractures a year, we estimate. So we actually need to get up to 60 a day. I don't think we're going to get that before the end of the year, but hopefully maybe next year sometime when people get better at their jobs, we'll get better at that. And there's our little executive committee. There's the clinical lead, the registry coordinator, which is Nicola. We've got the mentor, who works, I think, 3 days a week, and we've got Chris Gill, who's the executive director from ANZ that manages all the contracting with ACC. So we meet every week and keep things going. But now the real work begins. We've got lots of people to train. We've got to keep everybody on track, and we've got to write our first report. So we're taking a data slice from the 1st of July 22 to end of June 23, and we're hoping to have our first report out in early 24 because we have to do the 16 weeks follow-up. So we take our data slice in about October or early November, and then we've got 3 or 4 months over the summer to get it ready to report. And that's where we're up to. Thank you.